A new global study has brought fresh urgency to a long-simmering public health concern. Ultra-processed foods may be doing more than just filling nutritional gaps. They may be actively shortening human lifespans. According to this large-scale research, published in the American Journal of Preventive Medicine, diets high in ultra-processed foods were associated with an increased risk of death before age 70, with estimates suggesting that up to 14% of all premature deaths in the U.S. could be linked to these food products. The implications are significant, and while the findings are sobering, they also shine a light on an opportunity, perhaps one of the most impactful lifestyle adjustments within our reach. The research analyzed the eating patterns and health outcomes of over 240,000 adults across 8 countries, including the United States, the United Kingdom, Canada, and several South American nations. What emerged was a consistent pattern. The higher the intake of ultra-processed foods, the greater the risk of premature death. Specifically, every 10% increase in daily calories from ultra-processed food was linked to a nearly 3% higher risk of dying before age 70. For individuals with already elevated health risks, those with diabetes, obesity, or cardiovascular conditions, this association could be even more pronounced. Yet while the news has a clear warning embedded within it, there's also reason for optimism. Unlike certain genetic predispositions or uncontrollable environmental factors, the composition of our diets remains one of the most modifiable elements of our lives. Understanding the risks tied to ultra-processed foods doesn't just warn us, it arms us. It gives people a way to fight back against chronic disease and premature mortality with tangible, everyday choices. The key lies in identifying what ultra-processed foods are and understanding how they differ from both minimally processed and traditionally prepared meals. According to the Nova Food Classification System, ultra-processed foods are not just altered for convenience. They are fundamentally re-engineered with preservatives, colorings, artificial flavors, and additives. They often contain ingredients that don't exist in home kitchens, compounds created in laboratories to extend shelf life and enhance texture and taste, but at a significant nutritional cost. These products are designed to be palatable, inexpensive, and easy to consume in large quantities. Think of soft drinks, packaged pastries, chips, frozen pizzas, and sugary breakfast cereals. While convenient, their nutritional profiles are often skewed, low in fiber, protein, and micronutrients, but high in sodium, refined sugars, and industrial fats. As they crowd out more nourishing foods in the average diet, they don't just fill the stomach, they subtly erode long-term health. Fortunately, small and steady shifts away from these foods can yield real benefits. A diet composed primarily of whole and minimally processed foods, fruits, vegetables, legumes, whole grains, nuts, seeds, and lean proteins, has repeatedly been linked to better metabolic health, reduced inflammation, and improved longevity. These foods nourish the body rather than merely stimulate the taste buds. They foster gut health, support a healthy immune system, and help regulate blood sugar, cholesterol, and blood pressure levels. Even modest reductions in ultra-processed food consumption can bring measurable health gains. That's why many nutrition experts now suggest a realistic but focused approach. Aim to have the bulk of your meals, around 80 to 85%, made up of wholesome, nutrient-dense options. The remaining 15 to 20% can accommodate more processed choices, ideally selected with attention to ingredient quality and nutritional value. Not all processed foods are created equal. A fortified whole grain cereal or a low-sugar, fiber-rich protein bar may still be ultra-processed by definition, but their impact on health is far less severe than that of soda or candy. Importantly, this study also calls attention to the broader food environment. Many people are not over-consuming ultra-processed foods because they lack willpower or knowledge, but because these foods are often more accessible, affordable, and heavily marketed than healthier alternatives. Structural change is needed through public policy, education, and industry reform to ensure that all individuals, regardless of income or geography, have the opportunity to choose health-promoting foods. Until those changes take root, education and awareness are critical. Studies like this one do more than sound the alarm. They empower people with knowledge. When we understand that certain choices are directly correlated with years of life lost or gained, we're better equipped to make conscious decisions about what we eat and why. There is also a deeper cultural opportunity here, to reconnect with food as a source of life, not just convenience. Cooking, sharing meals, and eating mindfully can help dismantle the processed food trap. The rise of farmers' markets, community-supported agriculture, and interest in traditional cooking methods all point to a growing appetite for change, a return to simpler, more nourishing ways of eating. So while the news may seem grim at first glance, it's also full of potential. It means that each meal, each snack, each grocery list is a moment of choice. A chance to steer a little closer to vitality and a little further from preventable disease. Ultra-processed foods have crept into nearly every corner of our diets, but the solution doesn't require perfection. It requires awareness, persistence, and a willingness to prioritize long-term well-being over momentary ease. The warning is clear, but so is the path forward. Food is not just fuel, it is medicine, culture, and the foundation of life. By rethinking what we eat and why, we're not just avoiding early death, we're investing in a longer, stronger, more vibrant life.